Good afternoon. My name's Lisa Houston, and I am going to talk today about ventilation versus oxygenation. How can we help? Let's review. So when we talk about the pulmonary system in the NICU, one of the things that we really need to understand is that the majority of the diseases and the reasons babies are admitted to the NICU is because of dysfunction in the pulmonary system. Whether that's prematurity and you just have respiratory distress syndrome, whether that's meconium aspiration in a late-term baby or a full-term baby, whether that might be transient tachypnea of the newborn in kind of those late preterms, early-term babies. No matter what, the majority of our babies are admitted to the NICU with respiratory problems. So we need to understand, what are we looking at so that we can best help our babies? When we think about ventilation, we think to ourselves, how well are the lungs able to exchange oxygen and carbon dioxide? So ventilation is the process of gas exchange, whereas oxygenation tells us how well the lungs are taking that oxygen in and then distributing it to the rest of the body. When you think about oxygenation, you're going to think about that pulse oximeter. What is the pulse oximeter telling us about the baby? So let's dive into ventilation. So if we're thinking about ventilation and how the gases are being exchanged, we would want those gases to be exchanged well. That would show to us in a stable blood gas, in a CO2 monitor, whether that's a transcutaneous or in your blood gas. That would be in our respiratory rate, in our work of breathing. How well does this baby breathe in order to exchange those gases well? Are they having to work really hard? Are they grunting and kind of keeping this auto peep so that there is a surface area for gas exchange? Things that get in the way of this process are apnea, right? The number one diagnosis of prematurity. Pneumonia, PIE, pulmonary interstitial emphysema, when we have those little air sockets that are just squeezing parts of the lung open. Obviously, if we have a collapsed lung from a pneumothorax, poor expansion, maybe our gut is very full because we've got a big old air bubble in there and we need to get some air out of our belly. All of these are going to hinder our ventilation. Poor ventilation requires an increase in ventilation, a change in mode, stimulation if the baby's apneic, or medications. Some of these medications could include caffeine for apnea of prematurity. So if your baby's apneic when you come to them, that is a ventilation problem. They are not able to exchange their gases if they are not breathing. So simply turning up the oxygen on a baby who is apneic is not going to help them recover. If your baby has a high CO2, whether on that blood gas, on your transcutaneous monitoring, that might be saying to us like, hey, this mode of ventilation I'm on is not working for me. So if we have some poor ventilation and we need to have a change in that, let's think about the steps of that process. Maybe your baby's on room air, so we might need to go to high humidity nasal cannula or high flow nasal cannula. If that's not enough, maybe we need to get to CPAP or go to non-invasive, or we might end up having to intubate this baby. All of those are likely steps to help with this ventilation so that the baby has a better opportunity to exchange their carbon dioxide and their oxygen to have good ventilation. Now let's dig into oxygenation. So this is telling us how easily that oxygen is absorbed into the lungs and distributed out into the body. So the lungs take in the oxygen, they circulate it back to the heart's pumping it out into the body. And we're going to see that in our oximeter, and then there's always going to be an O2 reading on your blood gas as well. Things that are going to hinder this process. Think about anemia. If you don't have enough circulating red blood cells, we cannot oxygenate the whole entire body. Think about your patent ductus arteriosus. If there's mixing of blood, some of that oxygenated blood actually doesn't make it to its destination. So in that situation, we would want to help repair and close that PDA. Persistent pulmonary hypertension. That hypertension in the lung heart circuit prohibits effective oxygenation to the entire body because the blood cannot get to the lungs to get oxygenated. So how are we going to help with that? If we have low saturations, we might need to increase our oxygen percentage. If we have anemia, maybe we need a blood transfusion. PPHN, we might need nitric oxide, right? Nitric oxide works to relax the pulmonary vessels so that the air can move and the oxygen can get into the cells so that it can be distributed. Again, if we have a PDA, we might need medication such as ibuprofen to close that. With poor oxygenation, for those babies that have saturation alarms or drifty or they're swinging a lot, they might just need more oxygen, not necessarily stimulation. So if you go in there and your baby is breathing, their chest wall is moving, their heart rate is stable, but their saturations are dipping, maybe they're going to the low 80s, the upper 70s, it might just mean that they need more oxygen to help them keep their saturation stable. So when you think about this in relation to alarm management, right? We always want to say we want to help the baby as best we can when we go into the room. So your monitor goes off, it shows signs of apnea or bradycardia. That means your baby probably needs stimulation. They might need to be repositioned. They might end up needing PPV, right? Positive pressure ventilation, because ventilation in the respiratory system are our biggest cause of heart rate drops in our NICU, in our patient population. Our babies aren't usually in cardiac failure, they're usually in respiratory failure. So if we can help them breathe, they're going to be able to recover faster. But when you think about a desaturation, it could be from an obstruction. So you might want to clear the airway. Maybe you're seeing some liquid in their mouth. It might need that they simply need to have an increase in oxygen. Maybe they do need to open their airway a little bit, a little neck roll, something to help them with that. But that really differentiates between what's happening in regard to ventilation and oxygenation. There's more of these videos here on our YouTube channel, so feel free to come back and join us and let us know other topics you'd like to cover.